The other thing that's important, which I don't know how I missed this slide in here, is headaches in pregnancy. Headaches are really common with people that have IIH, and the goal is to treat patients until they don't have a headache as early in the pregnancy as possible. Once we get into the third trimester, or even the late second trimester, it can be really confusing between IIH and other reasons people have headaches in pregnancy. Preeclampsia, which is when you have a headache and protein in your urine, or symptom of a headache. You can also have blurry vision. You can also have pain up here at the top over your liver, right upper quadrant pain, plus elevated blood pressure, plus abnormal labs, which we look for as protein in your urine. You can also have evidence of liver damage and kidney damage. Preeclampsia can have symptoms that look just like IIH. A headache that's unrelieved with Tylenol and blurry vision. What do people have with IIH? Double vision, headaches that are pulsatile in fashion, and guess what? They're not relieved with Tylenol. So it's really important for us to get somebody on a treatment regimen early in the pregnancy as possible so that we won't be confusing IIH and preeclampsia, because if a person gets referred to neurology with a headache, 9 times out of 10, they're going to say this headache is due to preeclampsia. Even if the patient has completely normal blood pressures, I have to call them back and say, try again. This is not what it is. But it does confuse the clinical picture. The difference between a headache that's caused by something like preeclampsia and a headache that's caused by IIH is that preeclampsia has to have high blood pressure. IIH has high intracranial pressure, but usually does not present with high blood pressure. Now, people that have IIH do have a higher likelihood of having chronic hypertension, meaning high blood pressure outside of pregnancy. Why is that? Some people with IIH, when we look at the characteristics of patients, they can be overweight. People that are overweight have a higher risk of chronic hypertension, but the two don't go the same, okay? So people that don't have chronic hypertension, meaning high blood pressure outside of pregnancy, if you have IIH, you should not be presenting with high blood pressure. So if a patient has a headache all of a sudden and they have IIH, but they were controlled on their Diamox or whatever the regimen was they were on, and now they have a headache despite that regimen, I'm going to work them up for preeclampsia. So I'm going to look at lab work to look at the kidneys and the liver and protein in your urine. And if any of those labs are significantly elevated, then I know that you have preeclampsia. Preeclampsia, we try to conservatively manage, meaning keep a patient pregnant. If you have severe range blood pressures or severe features of preeclampsia, like a headache or lab abnormalities, then we try to treat that acutely, meaning we try to give you blood pressure medicines, get your blood pressures under control, and we try to relieve your headache. And if we can do that, if you're before 34 weeks pregnant, we try to get you to 34 weeks and then deliver you. If you're beyond 34 weeks and you have severe range blood pressures at any time, even if they're treated, or lab abnormalities, then you're delivered at that time. For patients that have an unrelenting headache that are diagnosed with preeclampsia or symptoms, blurry vision that's persistent, pain in over their liver, then they get delivered. It doesn't matter if they're 24 or 25 weeks. People with IIH don't get delivered, okay? Delivery can cause you to have some relief of intracranial pressure just because your intra-abdominal pressure can play a role on your intracranial pressure. And so delivering you can cause you to have a little bit of relief, but usually it's not significant. And so delivery is not recommended early for patients with IIH because it's not going to help that headache. You still have a headache after you deliver. So the treatment would be go ahead and do the LP, go ahead and increase the Diamox, go ahead and do the surgical treatment and keep the patient pregnant. So the headache can confuse things, okay? Most common reason for a headache in pregnancy is just because of hormonal changes. But we're talking about pathological issues. It's preeclampsia. It's way more common than IIH. And so people are always going to be pushing for, hey, preeclampsia means delivery. But we do not want to deliver patients prematurely if we don't have to. if the headache is just because of IIH. So the telltale sign is going to be they have high blood pressure associated with the headache, or they don't have high blood pressure associated with the headache. That's going to be the deciding factor.